Yes, Assalamu alaikum. I hope I'll be able to finish on time because I have too much information for you. So I have two choices. Either cut off information or give you all the information and make you bored. Which one do you want? Cut off information. Okay. Okay, my name is Dr. Zahra Ali. I'm from Kenya, and as most of you know, also half Turkish. So I had a challenge to make the project, that presentation in English and Turkish, but I decided in English because most of us are foreigners. That's the greatest advantage for working with Green Crescent. For the other NGOs, it's difficult. Talking of, I'm going to talk mainly on the current addiction situation in Kenya, and I will tell you a bit about our Green Crescent in Kenya. I don't have a lot of statistics. I will not give you a lot of statistics the way our brother gave you, but I will be able to give you some information. My presentation will contain a background of Kenya, trade, types of addictions which are available in Kenya, areas mostly affected, and a bit of reasons and the outcome, some statistics which I'll tell you verbally, some actions which are being taken, and the latest status of Green Crescent Society of Kenya. As you all know, Kenya is in the eastern of Africa. It's right in the middle of East Africa. We have the equator passing right across us, and this makes Kenya a very special position. Why? When you look at our neighbors, we have Somalia, Ethiopia, Sudan, which mainly is now southern Sudan, Uganda, and Tanzania to the south. But don't forget, we have the Indian Ocean in the east. The Indian Ocean is a very, very important part, especially where drug addiction is concerned. You look at Somalia and Ethiopia plus Sudan, most of them are war zones. Yeah? Below Uganda, Uganda is more stable, but below Uganda, just across Lake Victoria, we have Rwanda, Burundi, which was a war zone area. And to the south, we have our neighbors, Tanzania, who are equally struggling like us. What do I mean by equally struggling? Kenya is in a critical position of being a transitional country for drug and human trafficking. Most of it is coming from Afghanistan. We hear a lot of migrations to the European countries. Nobody mentions migrations to Africa. Migration brings with it a lot of problems. And with the traffic coming mainly from Afghanistan and Pakistan, we have all those, especially heroin, being produced there, coming to East Africa through Mombasa. You can see a small town down there, which is almost next to Tanzania at the coast. That is where I come from, Mombasa, and it's the main entry of all the drugs and foreign people who are coming, stowaways coming through the sea. And from Kenya, after passing Mombasa, it is distributed to different countries throughout East Africa and Africa in general. I hope I'm not going too fast. Can the translators get me? Yeah, it's good? Okay. Now, most of the drug addictions in Kenya are located mainly in the cities. We have 5 main cities. Nairobi being our capital and the biggest city, it's right in the middle. Then we have Mombasa, which is right at the coast. From there we have Kisumu, Malindi, and the other cities around. Now, as I said, we are situated with the equator. Another thing we have to be proud, historians are saying that we are the cradle of humanity because the oldest fossils were discovered in Kenya. Our capital is Nairobi. We have a population of 47 million, and it has been estimated that every year we have an increase of 1 million new population coming in. I'll tell you the reason as we go up together. Our main economics input is through agriculture and tourism. Unfortunately, these two sectors are also the two sectors which contribute a lot to drug and other abuses in Kenya. When you think of agriculture, of course, you can think of cannabis, yeah? A lot of illegal growth. When you think of tourism, we have a lot of the tourists coming in. In fact, we have an area I will show you, which is called as the Italian Mafia town, and that is where you can find a lot of drugs. Our total land area, as you can see, is not a small land area. 48% is from agriculture. And another important factor is we have 40%, more than 40% actually, of our population being under the age of 15. Now, I'm sure you will ask me, this is good. If they're under age of 15, it means they are children, it means less drugs, isn't it? Unfortunately, that's not the situation in Kenya. The reason why our population is growing very fast is because our country, after realizing that we were getting a lot of AIDS, we have more than 3 million AIDS victims, HIV victims. They channeled the money of money for family planning into combating HIV victims. The Kenyan government, as you see there, went for combating HIV. I'm sure you all know who this is. Uhuru Kenyatta is the son of our founder. He's the youngest president. He has got his pros and not so good factors. I'll be telling you about him. But we all love him, and he's so far been the best president in Kenya, I can say. Now, the types of addictions we have in Kenya, just like what we have in Green Crescent, which is just right for Kenya, we have drug addiction, sex addiction, alcohol, tobacco, and IT. All these 5 sectors are very high in Kenya, unfortunately. And again, I will say, unfortunately, in the young population. I mentioned about us being a transit zone, most of it coming from Afghanistan. We have 2 types of drugs which can be abused in Kenya. We have the illicit one, which is the illegal drugs, mostly heroin, cocaine. Changa is a local alcohol which is brewed in Kenya. Bang, kuber. Kuber is a very horrible mixture. It's a mixture of cocaine, sugar, and some other chemicals called quine. And most of the time, they put it under the lower lip, which is like tobacco, something similar to tobacco, but it causes perforation of the lower lip and cancer. When you look at the people from outside, it's not very easy to know that this person is addicted initially. Then we have mandrax, which is also another illegal drug abuse. We have the legal ones, which are the licit one. This, for example, when I first heard of it when I was doing the research, I was surprised. Kenya is an alcohol-free country. We produce a lot of alcohol. In fact, the Kenya Brewery is one of the biggest taxpayers in Kenya. And apart from it being the taxpayer, we have having a big alcohol-producing company, we have a lot of other local traditional alcohols which are being produced, and they are local. Unfortunately, or fortunately, I don't know how you put it, Africans, we love partying. So in most of the non-Islamic parties, we have a lot of alcohol going around. In fact, if I'm to tell you some example, which I really had, at the coast, one of the traditional tribes We have 9 Mijikenda tribes at the coast. And one of the traditional Mijikenda tribes, what they do when somebody dies is to have alcohol parties. Yes, we have tobacco, which is legal, and we have miraa. Most of you would know it as cat. Unfortunately, and I'm very embarrassed to say this, Kenya is the biggest miraa producing country in the world. Just like we produce a lot of flowers going to Europe, every morning at 5 o'clock, we have hundreds of charter flights carrying this miraa to different countries, including Somalia. Drug and substance abuses in Kenya, the largest is alcohol. Even though 2012, they estimated that the alcohol consumption in Kenya the addiction was only 13.6%. Let me tell you, it's because they are not seeing the other addiction coming up. They are not considering somebody who is drunk on daily basis as addicted. They only consider the people addicted if they have liver problems and cirrhosis or other chronic diseases is when they consider that they are addicted. If they're not in that situation, they don't consider them as addicted. We have a lot of tobacco. Talking of alcohol, our government decided to combat alcohol after a large group of people consumed poisonous alcohol, and we had a lot of people going blind and dying. That's the time they said we have to fight alcohol. But the good outcome of it, yes, it is the ladies who led the fight against alcohol. There is an area in Kenya called Nyeri. If you go on internet, you will find the ladies decided to combine and form groups together. And if the husband comes home drunk, they are hit and chased out of the house. Because the husband spent all the money drinking, no money for food, no money for school fees. So they were beating and driving the husbands out. Then they went ahead and started pouring and breaking all the alcohol-producing factories which were around. And that way they got free. But unfortunately, these were not the Muslim groups. In coast region, none of the ladies moved up, unfortunately. We have tobacco. What the government did was, after some time, put out laws to implement some restriction. How? You are not allowed to smoke in public in Kenya, but unfortunately it was restricted in Nairobi and a little bit in Mombasa. In Nairobi today, if you go, you will never see anybody smoking in the streets. Instead, they have put small rooms, about a quarter of this hall, where if you want to smoke, these rooms are in the middle of the roads. If you want to smoke, you go and smoke in there as if you're in prison. And this made people stop smoking. Miraa and cat, this is a curse on Kenya. Unfortunately, as I said, it is the biggest, we are the biggest producers. In the last 2 years, we had a lot of different foreign countries forbidding miraa. One of those foreign countries was Turkey. They used to bring miraa to Turkey and in the name of vegetables and spices. And it took time before the government of Turkey realized that this is not vegetable and spices, it is drug. So they banned it, okay? Then came England. England banned the drug addiction as well. Last year, Somalia tried to ban this miraa. And unfortunately, it was the Kenyan miraa farmers who went crazy. They went crazy because it is one of the main income. It brings billions and billions of Kenya shillings per day to that area. Not per year, per day. So they went crazy. When England banned Mira, the Mira farmers challenged the government not to allow the English army, which normally comes to practice in Kenya. They wanted to ban the English army to come and practice in Kenya. When Somalia banned the import of Mira, this time they pushed our president, who unfortunately, that's his negative side, went all the way to Somalia, had some meetings with the Somalian government, and in Somalia, they made Mira free. Why? Because for the market for these people. The president went ahead and contributed 8 billion Kenya shillings, that's around $8 million, okay, for assisting the Mira people. Unfortunately, although many of the non-Muslim people are using Mira, it's mostly affecting the Islamic region where the Muslims are. And unfortunately, the Muslims are not taking it as a drug addiction. Instead, they are taking it as a family entertainment system, whereby you will find a mother, a father, a grandmother, a grandchild, and a grandfather, and the children sitting together over weekends. I think the voice is gone. Sitting together over weekends or evening, chewing this cast thing. They don't only chew the bark, but they also chew the leaves, which is more poisonous, and it is under a local name of Ngoka, which is eroding the brains of the people, unfortunately. Then you find the family members going ahead and starting to lease out, because they spend all the money on this Mira. It's not cheap. It's not cheap at all. A kilo is not less than $100. They go out and start leasing everything from the house, the televisions, the washing machines, whatever they have, to be able to buy this, because they can no longer live with this. This Mira causes the person chewing them not to lose appetite. So you can imagine, these people don't sleep. They don't sleep at all because of this substance. So you can imagine no food, no sleeping, no working. It's eroding the Islamic population in Kenya, unfortunately. We have marijuana. I will not talk about it a lot, but again, we are transit, so we have a lot of it. We have inhalant and solvents. In the streets of Mombasa, you will see young kids with bottles filled with glue. They're inhaling it. They live and move out in the streets, unfortunately. Heroin is another curse we are having, especially because they are sharing needles and transmitting HIV a lot. The government, this is where the government is really combating drug addiction. We have different methods they are using. For example, they tried to give them fresh needles for those who are registered. They are using a drug called methadone to be able to combat this. So we have small clinics all over the country, around, I think, 69 of them, to be able to handle heroin. But it is also finishing our society. Cocaine is another one. What surprised me was the prescription drugs. The doctor, you are ill, you go to the doctor and you're given a medication. Very simple, painkillers, Panadol. The people are using it like sweets. And this is causing other health problems, including chronic kidney diseases. They use a lot of sex enhancement drugs as well, especially the youth. We have anabolic steroids for those men who want to look macho and big. We have abuse in that, and contraceptives, especially among the sex-addicted people. Yes. One sad thing is we are having a very alarming rise in children using drugs. And this has gone down to the age of 5. What? How can a 5-year-old child be a drug addict? Unfortunately, the drug cartels and the drug dealers, the drug sellers, are finding very interesting methods of selling their drugs. What they are doing in primary schools around the schools is to produce sweets with drugs, and they sell them to the kids. After the kids get used to this, they have their stations. After the kids get used to this, they use those kids to sell the drugs to be able to get their medication, unfortunately. So Green Crescent is where we will have to really step in, increase our awareness and training programs in schools. Alcohol is also very high among children. It was estimated that the youth between 15 and 24, that is secondary and high school, university, 11.7% of the children, don't forget 40% of our population is children below 24, yeah? 11.7% of this population are alcohol addicts. 6.2 use tobacco. 4.7 are involved in Mira. They are saying 4.7 because they have not done proper statistics at the coastal and Islamic zones. These statistics were taken from Nairobi. And 1.5 using cannabis. It is estimated that every year, more than 1,000 new drug users join the club in Kenya. You can see the orange area is where the Muslim population is mainly found. That's where the drug abuse, sex abuse is mostly found, unfortunately. You can see that's the dark orange. Then there is another orange area down. That's the coastal area. That's the entrance of the drugs and human traffic. Right towards the middle upwards, you will see Malindi. Most of the foreigners in Malindi are Italians. They have special parties of foreign tour groups coming in to have sex tourism with kids who are as young as 8 years old. Why? Because these areas are the areas where we have poor population. Those kids are looking for ways and means of getting to school. So somebody pushes them there. It is not that a kid just sits and gets into drug. No. The kid is introduced to drugs either by a relative or a friend. Not just by standing, unfortunately. And after introduction to that area, many of the kids' parents are not even aware, although there are some parents who push their kids to this area as well. Because they feel if you move around with the white European guy, you will get rich, he will pay you all the money you need. Unfortunately, time up. Yes. Poor family, contraceptives, these are the people who use the sex. Alcohol is legal. We have no alcohol rehabilitation. There is no proper law prohibiting cigarette smoking, apart from the few. We have a very high IT addiction. And this IT addiction is showing that 40% of our kids have IT addiction. The mother and the father are too busy doing other things. If you're a rich family, what do? Give the kid iPad, give the kid telephone. Internet is free. The kids can reach everywhere. All the drugs, all the pornography, all the other bad things. And the worst addiction, IT addiction we have is Facebook. In Kenya, almost all the mobile phones have Facebook. So you see people not even working or anything, they are busy with Facebook. What are we doing? Can I have 3 minutes for this? Thank you very much. Yes, what are we doing as Green Crescent so far? We are mainly doing lobbying and trying to introduce our organization. There are many different organizations dealing with drugs, but mostly with heroin and HIV. So Green Crescent is working hard, trying to get in touch with these people so that we can make our work easy for alcohol or for HIV and the other drugs, while we will be able to concentrate on other addictions. We are collaborating and trying to introduce ourselves. We will be having some projects with the county governments. We have 47 county governments, but we are mainly targeting 7 of them, which are along the Islamic society, that's the coast. We are trying to go to special schools at the moment, not all schools, because not all teachers want drugs and other things taught in their school. So we are trying to move in with some special schools. The one we have started is Sheikh Khalifa, which is an Islamic institution. And together with that, we are dealing with youth and women empowerment groups. Why? Because we believe the reason why the youth are in these problems and the women with sex addiction and mirror addiction mostly is because they don't have the money. So we are trying to bring groups together and trying to get them incentives so that they can form some kind of job and give them vocational training so that they can go ahead and get some income and get out of there, as well as introduce them to the rehabilitation centers which are available so that they get subsidized services. Rehabilitation is extremely expensive in Kenya. It's more expensive than going to the university. It's extremely expensive. And one of the groups I can give you, some of the groups we are in contact is the Muslim Education Welfare Association. They have their own school, they have their own hospital, they have their own rehabilitation center. We are working with NACADA, that's the National Academic Advising Association, and also against alcohol and drug abuse. This is the national national NGO, but so far we have not got very much progress with them. We are working with Kenya Association of Muslim Professionals, camp, Kenya Association of Muslim Medical Professionals. We are working with a group called Outreach, and we are working with the university. We are working with IDB, that's Kenya, IDB, Kenya Association of the Graduates. Most of them know Turkish, that's an advantage for me. Rejuvenated Youth Welfare Initiation is one of the groups we started in order to be able to overcome some of the challenges we are facing. This is a youth group of 300 people. We only initiated it last month, but already 300 members. Most of them are from university graduates without jobs or high school without jobs. We have Halima Anwar Foundation. We are trying to set up the first alcoholic rehabilitation center in Kenya. We are working with Touching Lives Association. It's a group of housewives who are trying to reach those who cannot help themselves, including orphans. And we are working with Radio Rahma so that we can ease our announcements or, advertisements and that kind. Yes, thank you very much for listening to me, and thank you to Rukia for giving me some time.